Welcome to Stroke Forward. My name is Marcia Moran. For the next 40 minutes or so, we are going to talk about things that stroke survivors, or any brain injury survivor, deals with. If you look at me today, you probably don't see a person who had a stroke, but I feel it. My body functions differently. Do I think I will get back to 100%? Yes, because to think differently is to admit defeat. We will talk to all sorts of people who have been there, from survivors to caretakers to doctors, nurses, therapists, friends, and family who have seen us at our weakest. They have cheered us with their victories, no matter how large or how small. How did we get here? That's what this show is going to tell you. Bevan Choate was born in San Angelo, Texas, 1985. He is 37 years old. Bevan grew up in a cattle ranching family, cowboying since he could ride a horse, but perhaps due to the Waylon and Willie song, they didn't want him to grow up to be a cowboy. Bevan was given all the odd and less glamorous jobs. Bevan realized about midway through undergraduate school that he wanted to be a doctor. He was always a science geek at heart and figured medicine to be a noble application of science. Bevan excelled in medical school and completed his 5-year urology residency in Albuquerque at the University of New Mexico Hospital. He began practicing urology in Albuquerque. It was his calling. Bevan loves it. He loves his patients, and some of them even love him. Bevan did quite a bit of oncologic surgery and got good at robotic surgery using the Da Vinci robot. On December 3, 2020, he had a stroke, a left cerebral stroke due to left vertebral artery dissection. There was no attributable etiology, no trauma. He just got that lucky. Bevan had acute double vision, visual impairment, vertigo, left-sided ataxia, and loss of left fine motor function, inability to walk or balance. His chronic symptoms include loss of left fine motor function, balance issues, right-sided stroke neuropathy, and left-sided ataxia. Surgeries related to stroke included a ventricular shunt, a craniectomy, and a left cerebral strokeectomy. Yep, Bevan has about 80 to 85% of a brain. In other words, he is not playing with a full deck. He made achievements since his stroke, including being alive, walking, he cannot run. He wrote a novel detailing his experiences called The Stroke Artist. Bevan started a small business selling his acrylic palette knife paintings. About The Stroke Artist. Though technically a memoir, the book is intended to be a guide for those who are faced with a life-changing medical catastrophe. In his case, a stroke, which threatened Bevan's life, his physical liberty, and livelihood. With a touch of street slang and cowlot humor, he demystifies and decodes a lot of doctorly information regarding stroke and modern medical care. The title, The Stroke Artist, is tongue-in-cheek, of course. Bevan found a bit of freedom and validation in the small art business he created while recovering from the stroke. Bevan painted consistently when he wasn't doing physical rehab and sold quite a few paintings.
I'm delighted to introduce Dr. Bevan Choate to the call today. How are you doing, Dr. Choate?
I'm doing well, Marcia. Thank you for having me on.
My pleasure. So you are a doctor. My first question is, what is your field?
So I'm a urologist. So basically treating anything from the adrenal glands all the way down to the urethra. So, we deal with a lot of, men's and women's health issues, as well as, problems with plumbing, basically. So they call us human plumbers.
Okay. So you had your stroke on December 3rd, 2020.
Yes.
And it was probably a major change in direction for you. So tell me about it.
Yeah. So, I mean, for one, I was just kind of hitting my stride in terms of, getting a start in my career as a young physician, and woke up one morning with, symptoms that weren't really all that typical for a stroke, or at least in my mind. But yeah, the room spinning, uncontrollable nausea, vomiting, just couldn't even stand up, and something was way off, and lo and behold, I had a stroke. So yeah, I didn't really make the connection until they actually diagnosed me on a CT scan in the emergency department. And yeah, it was kind of like the whole ground kind of falls out beneath you moment. It's very scary.
Yeah. So how long was it that you had your stroke to the time they discovered that it was a stroke?
So, I mean, we got to the emergency department pretty quickly, and but the problem was that these symptoms occurred upon waking, so there wasn't really a way to determine when I had actually started with the stroke because I was asleep. And so I had missed my window for TPA and those kinds
Mhm.
of things. So um, it's really unknown.
Right. Okay. So how much did the stroke impact you?
Oh, massively. I mean, so it kept me away from, well, anything really, for about 52 days. I was in the hospital, 26 days in the ICU, and then 26 days at doing the sort of other step down hospitals and rehab hospitals. And then at that point, living in New Mexico, there aren't really any comprehensive stroke rehab centers here. So my wife and I drove to Dallas, which is about 10 hours away,
Ooh,
to do stroke therapy. Yeah. And so it kept me out for a while, and I returned, kind of in some capacity, to work about 3 months later. Um, but yeah, it basically, so it was a left cerebellar stroke. So a lot of visual difficulties. Still have trouble maintaining balance sometimes, and I have a left-sided ataxia. So knowing where my limbs are in space on the left side is a bit difficult. So it makes coordination and fine motor movements pretty difficult, which happens to be a big part of my job. But
right.
so yeah, and everyone says that magical, that year-long recovery that we all have to go through, and things will be pretty good at a year, which by the way is more or less false. But but so most of it was just waiting, and doing tons of therapy and rehabilitative exercises to see where I would more or less fall on the spectrum at a year. And so that was, so during that time period, back at work, I was able to at least do some basic charting and computer work type stuff.
Mhm.
And eventually I was able to start seeing patients back in the clinic again. I just wasn't allowed to operate.
Right.
Yeah.
So do your patients say anything to you?
No, actually, I mean, they're like, "Oh, I couldn't." I mean, I'll tell them. I'm frankly, I'm pretty honest with my patients, right?
Right.
Because it's not, it's not something that I feel like should be kept from someone, nor, and it's also, a way I can relate with. I have tons of patients that have had strokes, and so I can say, "Hey, look, I had one of those. I know what you're going through. At least I can imagine better than most, right?" And
Right.
so, so yeah. I mean, I had a lot of patients that were just glad I was alive. I almost died
Yeah.
twice while I was in the hospital with the stroke.
Wow.
Um, and so yeah,
So
overall, yeah, it's been. I mean, the interactions have been positive. Yeah.
so what happened in this hospital?
So from what I learned a lot about neurosurgery, things I hadn't thought about for several years, while I was in the hospital and while I was coherent. Most of the time I was sedated, with a tube in my throat. So a lot of things I don't necessarily remember. But
Mhm.
from what my wife told me, the biggest problem with my stroke was that all of the inflammation from the swelling and everything created from the blood clot in my left cerebellum caused a massive pressure increase within my skull. And the skull is a fixed volume. It doesn't really change like anything else. And so all that pressure has to go somewhere, and it generally starts putting pressure on other parts of the brain,
Mhm.
which can cause you to lose vital functions and things. And so that was happening to me. And they first tried to put an extraventricular drain into my skull, which is kind of like where they turn your skull into a Capri Sun to try to relieve pressure, and that didn't work. And so then they had to remove a piece of my skull, kind of on the back underside, in order to try to take pressure off that way. Then that didn't work. So they then had to cut out the infarcted part of my brain in order to create enough space for my good brain to to function and live happily. So it was a touch and go for a while.
Yeah.
Yeah.
So you had a vertebral artery dissection, is that correct?
Yeah. So yeah, the vertebral artery is like we have two of them, one on each side, and they run alongside this the vertebrae, or the spinal column, from the neck, you know, and down, through here. But yeah, they basically go up and supply, kind of the hind portion of the brain. And I think these are relatively common to be injured, especially like in a motor vehicle accident. Um, they always talk about, with chiropractic manipulation, these arteries can get sheared like mine was. But of course, I didn't have any of the typical history that
Right.
went along with this.
So how many people get this type of dissection, do you know?
That I don't know. I mean, it's as far as like a vertebral artery dissection, I've got to think that it's, I mean, relatively uncommon. But as far as things that could happen with that artery, I think it's common enough. The problem is I think only, so that's what they kind of list as like the cause of this particular type of dissection and stroke. But I
Mhm.
think it's something around only 40% of these vertebral artery dissections actually have some kind of traumatic event that incites it. And so basically what they're saying is 60% of the time we have no clue what's going on or why it happened.
Yep.
Yeah. And
Yep.
so, yeah.
Yeah, so I had a carotid artery dissection, so
Yikes. Yeah.
and they said, "I don't know. You
Yeah.
had it because you had it."
Beats me. Yeah.
Yeah.
And,
Yeah.
unless you were smoking like a chimney or something like that,
Yeah.
yeah, there's not really, yeah, a great cause for that happening either.
Yeah.
Um,
So, how did your wife um, feel about caregiving?
so she was a pro from day one. She's trained in family medicine. She's a family medicine doctor that now does hospitalist work. And so
Okay.
she was at least able to translate, for my family and speak doctor. And because at the time when this happened, it was the height of COVID. They weren't
Oh,
allowing anyone in. I mean, I wasn't allowed to have any visitors. In fact, a lot of my urology colleagues that worked at the university hospital were trying to come into my room and talk to me, but even that got shut down. So it was complete and total isolation. But yeah, no, my wife was great from day one, and still is. I mean, it was kind of cute because all her friends, and which are some of my guy friends as well, came over to my house, and essentially I called it kid proofing the house. They put grab bars in the bathroom. They removed this giant rug that I always used to trip on, and did a bunch of adaptive things to the house to kind of make the transition easier. So I'm super fortunate to have those people in my life.
Yeah. So if you were going to say one thing to your wife or your caregiver, what would that one thing be?
Thank you. Yeah. Thank you immensely for not giving up on me and just being patient with me.
Yep.
It's kind of funny, and I'm sure I was under the influence of a little bit of sedation, but I said, at one point I talked to her in the hospital and I said, "Hey, this is your chance. We're not married yet. We were engaged at the time. I said, you have a long life ahead of you. Get out while you can." And she said, "No, you're stuck with me for the long haul." So I'm
Yeah.
super fortunate.
She
I mean,
sounds beautiful.
oh yeah, just a wonderful human being, and still continues to provide a lot of support through all of this, because it's not you know the bed of roses every day. It's as I mean, having a stroke and having to deal with just basic things, like basic daily things, is a lot of work, and it can sometimes be very frustrating, and so to have someone in your life that can kind of step back and say, "Hey, just breathe for a little bit, what's going on." It's incredibly important and powerful.
Yeah. So I know that you've written a book called The Stroke Artist. What made you decide to write?
Initially it was it probably started out more as boredom, for the past, let's see, 10, 11 years. It was trying to be a physician, and then when you're a physician, now it's time to be a surgeon. When you're a surgeon, now it's time to be the best surgeon, and this and that. So it's like, it was go, 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 at least for the better part of a decade. And all of a sudden, my only, the only thing, I'm used to doing 47 different things at one time. And now they were like, well, you just have to go to rehab and try to get better. And I mean, that was a monumental feat, and still is, but
Hmm.
I just felt like I wasn't doing enough. And I was painting and doing some other things, anything that I could do with generally speaking, my dominant unaffected hand. But my urology colleague, who I trained with in residency, said, I was telling him all these funny, we think they're funny, we have sick sense of humor, but about getting catheterized and stuff like that, things that we used to do to people all the time. Now I'm the one that it's getting done to. And so he starts laughing, and he says, you should really write these things down. Some of these things are really funny. And I said, all right, well, I didn't like the idea of writing a book, but he said, you should do it. I think you'll appreciate it later. And I still wasn't convinced. And I said, well, maybe I'll do it, in order to retrain my left hand how to type, because that's something that I have to do for my job. Unfortunately, I have to type a lot. And um, so I just started writing things down, like almost journaling of all the things that happened to me in the past 2 months, related to the stroke. And as I kind of picked up some momentum, I started enjoying the process, and then thinking, I may actually be able to help people with this book, and may actually be able to shed light on some things that maybe people don't know. Maybe they're just not familiar with it, or maybe there's with all of the kind of cloak and dagger of medicine, all of the stuff that is seemingly kept patients' view. And so yeah, I just felt like I kind of had a little bit of a unique perspective being doctor turned patient, and especially doctor turned stroke survivor, that
Mm.
I may be able to add a little value in terms of what to expect, what the doctors are probably thinking, what you may be thinking, those kinds of things. And so once to answer your question, really, like once it got going, that's when all of the light bulbs and things went off. But initially, yeah, it was like, begrudgingly agreeing, boredom, trying to get my left hand to work again. And
Right.
and so yeah,